Okay, morning everyone. Thank you for joining us. My name is Paul Scoley. I'm the Senior Vice President of BlueJeans International. And look, I really want to thank you all for taking a bit of time out of your hectic days today to join us on this webinar. So I really do appreciate that. From Guy's and St Thomas's NHS Trust, I would just like to welcome Frank, who is the Enterprise Architect, Andrew and Justin, who are both Senior Digital Media Services Technicians at the Trust. So, gentlemen, welcome. Appreciate you taking a bit of time out to help us do this, and I'm really looking forward to talking to you. So thank you again. For those that have joined, just a couple of housekeeping items, if I may. First of all, welcome to using the BlueJeans events. If it's your first time using it, I hope you found it a relatively easy experience logging in. On the right-hand side of your screen, you'll see our navigation bar, and the third icon down is what we call the moderator chat feature. So if you experience any technical issues, please notify us using this function. The last icon you'll notice is the Q&A chat feature. So if you've got any questions about today's topics, please post them there. I do want to make sure we allow plenty of time to answer any questions you may have. So post them there, and I will promise you that we will get round to answering them towards the end. Lastly, just wanted to let everyone know this session is being recorded, and the recording will be sent to everyone who's registered for this event. So please, most importantly, do add Q&A into the feature. So first off, gentlemen, Frank, Andrew and Justin, welcome again. Guys and St Thomas's, just help me out a little bit here for the people on the who have attended. It's one of those trusts, it's one of those hospitals that everyone knows. I'm sure if we were to ask anyone, name 5 hospitals in this country, they'd probably all name their local hospital, and Guy's would be one of those 4. Just tell me, why is that? Is it just the biggest? Is it best known for clinical expertise? Is it just well known for treating our Prime Minister? I mean, just why is Guy's and St Thomas's on a pedestal, would you say? If you can be unbiased, that would be appreciated as well.
So if I'm being unbiased, I think we are probably the best. I think we top in the government league tables. You know, staff satisfaction is high. Patient satisfaction is high. We're always in the top 2 or 3, if not the top. Yeah.
Good.
We've got a big academic health sciences centre. We're very involved in bringing evidence into practice. We run the South England Biomedical Research Centre. So again, biomedical services. We've got a big genetics department. We've got the Evelina Children's Hospital, which south of the Thames is the #1 hospital in there for kids. So we do just about everything, including we run the community healthcare services for South Lambeth and Suffolk.
Okay, so you're well known as doing everything well, just general all-round excellence as opposed to being a particular niche. And then of course Central London, I guess that's probably why it's sort of, you know, well known. And I understand, I was Googling around, you also have the tallest hospital building in UK or in Europe. What was it, Andrew?
That's right. The Guy's Hospital Tower, which houses an extensive dental department, amongst other things, is the tallest hospital building in Europe. So that's a claim to fame. They do a charity event where you climb all 29 floors on, you know, via the stairs, which apparently is a bit of a chore.
I would say mark me down for that, but I think I would be. I think I might pass on that one. So tell me, if I could ask then a little bit about the drivers for change that you were that led you to come to talk to us at BlueJeans, which was not that long ago now, towards the end of last year when we first sort of engaged. Just tell me what were the drivers behind that? What brought you to that point where you figured that you needed to do something better, different, quicker, more effectively? You know, what was behind that?
So I suppose we need to begin. What are we using video conferencing for? And in healthcare, we've been ensuring that we decide on the best treatment plan for our patients. And one of the mechanisms that we've been employing for the last 20 or so years is something called multidisciplinary team meetings. And this happens in nearly all our specialties these days. And it's where the whole clinical team responsible for that patient's treatment plan, care, discuss each patient individually. And so that would include the diagnostic tests, so microbiologist, hematologist, radiologist, as well as the specialist doctors in those particular fields. And in the noughties, some point in the noughties, we started doing that using traditional video conferencing, because lots of these participants are on other hospital sites. So Guy's and St Thomas's, for example, we treat patients from the whole of the south of England. People, the district general hospitals will refer patients to us for more specialist care in cardiology or cancer or whatever that specialty might be. So the multidisciplinary team started using video conferencing quite a long time ago. We were doing around about 260 odd events, I think a month, 60 a week roughly.
Okay.
Using an old Codian bridge, and we needed to really modernise and move from that old, very enclosed. If you're not using H323, you're not part of the team. You can't join. We needed to move forward.
Okay. So that was, so you were early adopters then, obviously, of this technology, and how did you got to the stage where you needed to upgrade, you needed to kind of like refresh the technology? How did you go about making that decision? I mean, what did you do? And maybe were you all involved? Justin, were you involved in that decision to look at alternative technology, or was that Frank? How did that work?
Yeah, so we was all involved in that decision. We put a tender together, and we invited companies to come to us and demo their equipment. I think we had a look, and we tested around 7 or 8 different platforms over the last year, and BlueJeans come out on top.
Good. I'm pleased about that. Clearly, what was if I can bring it back to the business a little bit, you mentioned these multidisciplinary teams. I think that was what you talked about there, Frank. How have they changed now with the fact that you're doing these on BlueJeans? What are they doing? Are you doing more of them? Are you just doing them more effectively? Is it an easier experience than it was? Is it cheaper to run? I mean, how is the business benefited from the fact that they're doing it with a different piece of technology now?
So I think all of the above.
Okay.
But I think the key thing was we had rooms, a room in St Elsewhere's, a room in St Anywhere's, a room in Guy's, a room in St Thomas's, all in a physical video conferencing collaboration. Okay. What's happened now, of course, is people don't need to be in those rooms. They can join from home. Under COVID, for example, people could attend and contribute and from their own devices, and it's really changed. I think the guys, Drew and Justin, can tell you more about that level of detail.
Okay.
Yeah. Well,
I suppose
go
on, Drew.
After you.
Right. So yeah, it's really changed the way we work. I suppose first and foremost, our main priority is the care for our patients, and that's one of our values in the hospital. That no matter where you work, we don't forget that the number one priority is that everything we do, it will impact a patient. So over the last few months with COVID, of course, we've had people isolating. Now, if you've got one of our consultants who needs to isolate at home, if we didn't have BlueJeans, he wouldn't be able to participate in these MDMs, and the patient wouldn't get their care. So with BlueJeans, she's been able to connect to the MDMs from their laptop at home, and we've still been able to put a treatment plan together for our patients. Moving out of lockdown, we've now found that I saw a consultant joining a call whilst dropping his kid off at school round the corner, and then jogging to the hospital whilst on the call. So it's just a massive flexibility. And I think, like you mentioned earlier, or Frank mentioned, we had around 60 calls a week about a year ago. Since moving to BlueJeans, we're now up to 800 calls a week, and it's growing. We're getting email requests every day, people wanting to have heard of BlueJeans, have been told from one of their colleagues about it, and want to adopt it, because I think moving forward, people will work from home more. And if we can be flexible with meetings, then it's a good thing all round for us.
So essentially, to boil it down, really what you're saying is that everyone had to physically go to the conference room. I think that's what you were pointing out, had to physically go to one of the conference rooms, join one of these multidisciplinary teams, and now they can literally, how many people do you have on one of these things? If it was a particular case or whatever, I mean, is it 10, is it 15, is it 20? I mean, typically...
we have the head, for example, the head and neck MDM on a Friday morning has about maybe 40, 50 people in the room, pre-COVID. And so now obviously they're all separate, disparate around London, wherever, and they can just join in wherever they are.
And it's a great story then.
Yeah.
So go on.
If
they were self-isolating, I think that's a great thing you said just there. So if someone that was invited to that was self-isolating, given COVID, without it, you just have to do without them. They just wouldn't be able to contribute, even if they were fit and healthy, but just self-isolating.
These meetings have to meet a certain criteria to then go ahead. So you have to have a certain person from each discipline for the meeting to go ahead. So if they couldn't make it for any reason, then that meeting would be delayed, and all those patients would then be delayed until the following week, plus that week's patients. And so it just grows exponentially.
And you have a backlog, and you can then you're back in a situation where you're just pedaling like crazy just to keep keep moving forward in any way, shape or form.
Yeah, exactly.
Wow. So this seems to have been I don't want to exaggerate it at all, because COVID has clearly been dramatic, and but it has had a noticeable impact on the Trust's ability to respond and deal with what was clearly a horrible experience for everyone.
I mean, it couldn't have come at a better time, BlueJeans, because if we didn't have it, we would have been in a real bad mess. I mean, I think we were due to go live 2 weeks after COVID hit, so we had to push it forward, and your guys were great in helping us do that, and we had to get it working within a matter of days. And some of the patients, their care can't wait. If they've got cancer and they need treatment, they need a new valve in their heart. These are the sort of treatments that can't wait, and they need to be acted upon. So I wouldn't like to even think about where we would have been without a platform like BlueJeans.
Okay. How did what challenge did that have? Because we see that with a lot of our customers. I mean, clearly it's highlighted in this world of, frontline NHS care. But not everyone on the call who's attended is from frontline NHS care. But all organisations, when it hit, whether or not they're just, traditional business or whatever, had to roll this out at pace. Because maybe they were just sending their employees home, or in this case, you were trying to provide critical services to the patients. What advice, let's clearly hope we're never in that situation again, but we're always going to be in situations where we need to do things quicker than we would have liked. What advice would you give people that might be in that situation, which is something's changed, we need to respond, we need to, just get things done incredibly quickly, as opposed to perhaps in a more traditionally structured kind of planned approach? What were your learnings? What advice would you give people that might be in that situation at some point in the future?
I mean, you've just got to go with it. Yeah, you've just got to go with it. Every user, you're going to have users that don't want to adopt it.
Sure.
But yeah,
I think people's hands were forced in this, weren't they? Because you could see that the impending coming towards you, and you knew you had to do something.
I think people do embrace it once they use it. They may not be so open at first, but once they use it and they see how good and how easy it is. So we may send a link, someone's on their laptop at home, we'll say, right, well, if you want to join that MDM on Wednesday morning, here's the link. And they'll be, well, what do I do with that? Well, you just press it like any other link. It'll prompt you to download the app. So we recommend you do that, and you're in a call and you're talking, and it really is as simple as that. So it's just getting your users to adopt it, really.
Yeah. Okay. And any tricks there? Any tricks there about use of adopt? I mean, unnatural time. I'm sure it was needs must. I would assume, but yeah.
I think it's difficult with COVID because COVID really just just pushed everybody into that can do, must do, have to approach to things.
Yeah. Okay. And what's the future hold now that hopefully things are getting slightly back to normal? I'm sure it's less the case for you than anyone else. But now that we are doing our best to get back to normal, is there, what does the future hold for this world of video conferencing and perhaps collaboration more generally within the trust?
I think from my perspective, and the guys obviously might not necessarily agree with this, but I think it's just going to be pervasive. I think wherever there is the potential for video to be used, it's going to be embedded in a workflow somewhere.
And it just makes sense, doesn't it? That our clinicians are very, very busy people. If they can sit in their room and join a call, and that takes the 10 minutes it would take to walk to the different side of the hospital to be in the room, they'll sit in their office and do the call, and then that gives them 10 minutes to do something else. We've found as well that we're getting a lot of requests for patient groups now because we still have to social distance. We're not allowed to bring a patient group that would come in the hospital. 20 patients would come in the hospital. We still can't do that. So now we're being asked if we can set up patient groups and more patient-facing meetings using BlueJeans. So
and they have been happening as well, and people have been feeding back and been very positive. Even a patient downloading the app said it was all very easy to join. And they just clicked and off they went, kind of thing, and they were very happy with their experience.
What type of thing would that be, Drew? I mean, if I was a patient, presumably, obviously there's going to be some things that you just can't do. I get, of course,
no,
state the obvious. But what is it? Is it post? Is it counselling?
It's usually post. It's usually post-experience kind of groups. So, for example, if you're a patient on a ward, over a certain period of time, you get to know the other patients on a ward, and then once you're all discharged, they might all get you back together, talk about your experiences, and if there's anything else they can do for you, that kind of thing.
Therapy,
as far as like group therapy kind of sessions in terms of just talking stuff over or finding out information.
So and those essentially are being done now via BlueJeans because we're still clearly coming out of COVID, and there's people might be reluctant to travel or whatever, and you've got to observe social distancing. Do you think that will continue afterwards for reasons of efficiency? And if I don't need to see you face to face, it's just cheaper and easier and better all round, or probably not better. But
these patients would have been ferried in via patient transport, and I've seen the queue of patient transport buses outside, guys, and it's not somewhere you want to be. So if you can do it via video, then that's a win for everyone.
Okay.
It's a win all round, isn't it? It frees up space in the hospital. Yeah. It frees up vehicles on the London roads. The patients who may still not be very well don't have to leave their house. I mean, there's just so many benefits.
Yeah. Okay. So things will change long term as well, which I guess we're seeing across business, the world in general, isn't it? COVID's going to have long term implications, even when it's hopefully, a thing of the past. The change that was brought about, whatever it might be, the high street, the working practices, or the way we deal with patients is going to be longer lasting. So, look, gentlemen, I found that fascinating. Thank you for that insight. I'm going to move over to some of the questions that we've had, if I may. Before I would like to do that, I would just like to introduce Dan Morris. Dan, I think you know well, gentlemen. Dan worked for our partner here. He's a solutions specialist at SSC AVS, and we work very closely. I think the three of us, BlueJeans guys, and SSC AVS. So I've invited Dan to the call. Dan, I mean, that was great to hear, wasn't it? And you must be proud to have been involved in that, I'm sure, and do your little bit, to keep the world a little bit safer. Albeit, I don't want to exaggerate that. In the grand scheme of things, it was a tiny bit, but it must make you feel good about what your work, the job you've done to help guys do this.
Yeah, it's. I mean, firstly, I'd like just to say thank you for the opportunity to work with the fantastic guys in St Thomas's team during what was quite literally an unprecedented time.
Yeah.
The team, us, BlueJeans, we were all working under immense pressure during an increased volume of patients with the seriousness of COVID-19 to the most vulnerable patients. The team needed to act quickly to cope with an influx of patients requiring critical care. I guess our collective ability to resource deploy and scale up the solution deployed, which has now supported the remote clinical teams by standing up a high-performance, fully interoperable, platform-agnostic telemedicine solution.
Okay, and thank you. And just generally, I mean, when you went live, there's a question here that's come in. Did you measure the feedback, by the way? I mean, I know that we have got tools within BlueJeans when you can look at feedback and did you measure that and adoption, or was it frankly all hands to the pump and perhaps some of the niceties that you might do in a normal project had to be forgotten about for a little while? But did you measure that user feedback and adoption?
Yeah, the user feedback was very useful via Command Center. We can look at that and get all the analytics and diagnostics, all that kind of stuff from Command Center, which really helps if someone's saying this is terrible, couldn't hear anything. You can then look into why that might have been, and you can even get in touch with them if they've left a helpful name.
And did you tell that consultant what does he expect if he's jogging?
Well,
he actually left good feedback, so we left him. I mean, the command center has been brilliant. We did have, I mean, it's not been without its challenges. Adopting BlueJeans, we moved over to a new network a few months ago, and there were various things, and we had already moved over to BlueJeans, and there was various things that wasn't done on various firewalls on the new network. And we had some real issues finding out what firewalls and who they belong to. Okay. And the feedback, it fell through the floor. We just had bad feedback after bad feedback, and it was nothing to do with BlueJeans. The problem lied elsewhere. But now we've sorted that. We've now seen we're getting good feedback again. The percentages are going up of great feedback, and we can now see that sort of plateauing out and coming back good. So if we was to download the report of that, we would see the drop of when we had our firewall issues, and then it going back up after we'd sorted it out. So we can download that and we can present that to our bosses and say, look, this is the effect it had on BlueJeans.
Yeah. Good. Yeah, it is often it's the bit that the user starts using when that surfaces up some of these underlying problems. We hear that a lot. A question that's come in from Andrena, who says, I'm assuming that you can pull up case notes or test and x-ray results, etc., to inform decision support. I'm assuming that's the case, just with sharing screen and that.
So that is what we do in an MDM. Our MDM rooms have, like Frank was saying, many different specialities, and they all have a station. The histopathologist, they'll be at the microscope. You'll have the radiologist opposite on a PACS workstation, and so on. And what they can do is they hit a button on a touch panel, which then shares through BlueJeans whatever they're looking at their screen, whether it be X-rays, slides of a biopsy, and then they discuss what they've found, and everybody can see that.
Yeah.
Can I just just to make everybody feel comfortable, the radiologist or the histopathologist would have already reviewed that clinical image, made a report, made a decision of their findings before they go to the MDT. So we're not trying to decide whether that little grey splodge is something dangerous or not in the MDT. Okay. The radiologist has already done that piece of work. In the MDT, he comes and he says, "See this little grey splodge? This is bad news."
Okay. Yeah. Okay. I understand. But once again, it's probably done in a more secure way as well, I would imagine, than maybe filing emails and having people go backwards and forwards with images on their laptops and things like this, which is clearly pretty important when it comes to patient data, more so than ever.
Yeah. Encryption was one of the must-haves which BlueJeans has. Okay. So.
Good. Thank you. Question from Daniel. What I like this question. What was it about BlueJeans that made it come out over the other solutions that you saw? Can you put your finger on it?
For me, one of the things was the Dolby audio.
Okay.
It just head and shoulders above the rest. That's my kind of background. And it just noticed it straight away. And using other applications, with friends and family, I'm just like, oh, can't we just use BlueJeans? This is terrible. So that was my reason. And audio, despite video being important, audio is still king. Like in terms of communication, if we haven't got audio on a video call, it's next to useless.
You're wasting your time.
Exactly. So audio is very important.
I think for me the command center was one of the big things. Just the amount of detail you get in the command center, how you can drill down to each individual person connected. That did it for me.
Yeah, identify problems and troubleshoot perhaps sometimes before they even know there's a problem. Frank, and anything to add to that? The manageability, which is what Justin's saying, and the Dolby, which for those that don't know, it's great at filtering out.
I echo those two particular things, because they were the real killers. But I think other things, the Teams gateway, there was loads of other little bits which just gave it an edge.
Okay. Yeah. Good, and I'm pleased as well that you made a comment earlier on that we were there to help you through the through the deployment and through the accelerated adoption as well. So I was pleased to hear that. So look, gentlemen, I think that wraps it up now. I think we've handled most of the questions. Thank you again for your time. We really, really do appreciate that you doing this for us. And for me, a heartfelt thanks for, everything that you're doing and everything that you've done over the last few months, guys in St. Thomas's generally, and also yourselves to do your bit to keep us all safe. So thank you for that. We are delighted, and I'm sure Dan is from SCC, to have done our little bit to support you in those endeavours. So thank you for all that you've done. Thank you for taking the time to do this. It's been a pleasure talking to you, and I really do wish you well and look forward to supporting you and working with you in the coming months and years, hopefully. So thank you once again.
Thank you.
Thank you.
Thank you. I think we're done.